Judy was boring.
Hello.
Then Judy discovered ChumbaCasino.com.
It's my little escape.
Now Judy's the life of the party.
Oh, baby, mama's bringing home the bacon.
Whoa, take it easy, Judy. The Chumba life is for everybody. So go to ChumbaCasino.com and play over 100 casino-style games. Join today and play for free for your chance to redeem some serious prizes. ChumbaCasino.com. No purchase necessary. Void where prohibited by law. 18 plus terms and conditions apply. See website for details.
Hey all, welcome back to the Real Life Pharmacology Podcast. I am your host, Pharmacist Eric Christensen, and I thank you so much for listening today. As always, go check out reallifepharmacology.com. Get your free 31-page PDF on the top 200 drugs. Great study guide, great resource, great refresher, no matter where you're at in practice or whether you're a student studying for board exams in nursing and pharmacy and med school. So go take advantage of that. Sign up at reallifepharmacology.com. Simply an email is all it's going to take for you to get access to that. So kind of a no-brainer there. So with that, let's get into the drug of the day, and that is Lansoprazole. Brand name of this medication is Prevacid. This is a PPI, so proton pump inhibitor. Ultimately, it blocks proton pumps in the gut, the stomach, and those pumps are essentially responsible for producing hydrogen ions, pumping hydrogen ions into the stomach, which gives it its acidic environment. So if we block those pumps, naturally we are going to raise the pH, and the stomach will be less acidic, which is hopefully going to help with things like heartburn, stomach ulcers, and things of that nature. So indications, what do we use this for? Obviously, like I mentioned, heartburn, GERD, peptic ulcer disease, GI prophylaxis and prevention. You'll see that a lot in patients who are anemic and maybe on higher risk meds like anticoagulants, NSAIDs. You'll definitely see PPIs like lansoprazole used for that. Other situations, Barrett's esophagus, Zollinger-Ellison syndrome, just generalized dyspepsia. You definitely see these drugs used a ton in clinical practice. Dosing of lansoprazole, usually 15 to 30 milligrams once a day is what I typically see for most patients, especially when you're talking about kind of your garden variety, heartburn, that type of thing. You're going to see those lower doses in general. Do see up to, 30 milligrams twice a day. That's generally reserved for more serious situations, ulceration, Barrett's esophagus, and stuff like that. So administration, ideally, a half hour to an hour before eating, and that's to maximize the drug getting into the body and shutting off those hydrogen pumps, which are going to be stimulated by the presence of dietary intake, food. Really, really important practice thing. At least I strongly encourage that. You need to reassess these drugs, okay? So whether you're a pharmacist or you're a practicing physician, please take the time, set an end date with patients. If it's a condition like GERD, for example, set an end date where it prompts us to reassess what the patient's symptoms are and do they need this long term, because there are risks long term, and I'll certainly talk about those coming up a little bit. But over the counter, that's another situation to be really careful with. Keep an eye out for patients with kind of alarm symptoms or scarier symptoms, significant weight loss associated with heartburn and stomach upset. Obviously, blood in the stool, nausea and vomiting, significant pain or GI pain with that. Those are situations where we've got to make sure to work on the diagnosis side and make sure that there's not something else bigger going on. Those patients should be worked up if they're trying to take this medication over the counter and they're using it to kind of avoid seeking medical care and they have some of those alarm symptoms. So definitely pay attention to that. For that reassessment period, most are going to try to look at that. When we're talking about the case of GERD, heartburn symptoms, you're going to definitely want to assess that, somewhere in the range of 4 to 8 weeks. And ideally, if things are going well, we're going to try to, if they're on a higher dose, we might taper them down a little bit. But if they're on a lower dose, we might just try off of that medication if we're kind of through our course and the patient's doing well there. Now, in situations where there are going to be appropriate long-term uses for lansoprazole, so Barrett's esophagus, Zollinger-Ellison, those are two situations where we're probably going to be on this medication long-term. All right, let's get into adverse drug reactions. Generally, PPIs like lansoprazole are very well tolerated. Okay, I don't see a ton of immediate side effects within the first day, first week. It's generally not too much of an issue. Now there can be some changes in gut feelings and things like that, but mostly what we worry about is kind of the longer term effects for people taking chronic therapy. So over time, having that higher pH or lower acidic environment, more basic environment in the stomach, that can impair potentially the absorption of vitamin B12. So that's something we got to pay attention to. Low magnesium has also been associated with that. Poor absorption of iron has been associated with long-term use of PPIs. Increased risk of C. diff and other GI infections as well. So rare renal disease issues, potentially increased risk of fracture as well has been reported. So there's a lot of, generally the risks are pretty low, but there's a lot of potential adverse effects in chronic therapy. So we've got to pay attention to that. If patients need long-term therapy and it's appropriate, that's totally fine, but we should monitor for some of these issues for sure. On the kinetics side of things, primarily broken down by the liver. So CYP enzymes are going to be the primary breakdown method of the drug and why it stops working and how the body shuts it down. And CYP2C19 and CYP3A4 are the two primary enzymes, with probably 2C19 being a little bit more prevalent as far as its frequency of breakdown of the drug. So dosing with renal function, it doesn't really matter. The liver's more in charge here. So if you got patients with issues with liver impairment, significant liver impairment, we may have to look at reducing dosages in that situation. All right, let's take a quick break from our sponsor and we'll wrap up with drug interactions. If you're in the market for pharmacist board certification study material like ambulatory care, geriatrics, pharmacotherapy, BCM, TMS, definitely go check out meded101.com/store. We've got a growing list of resources, and I want to include pharmacy students there as well. We've got NAPLEX content, and that is growing as well. We're adding questions to our content and different stuff based upon feedback we get each year. So great resources. They help support this podcast, and obviously they're going to help you pass your exam as well. So go check all those out, meded101.com/store. If you're a nurse, med student, physician, I got lots of different books on Amazon on polypharmacy and drug interactions, case studies. Go check those out. Your purchases there definitely go to directly support this podcast and help me keep rolling with it. So I appreciate all the help we get there at meded101.com/store. All right, finishing up on drug interactions. Going to mention clopidogrel first. So there is potentially some inhibitory action of by lansoprazole on 2C19. This could, in theory, reduce the effectiveness of clopidogrel. I've talked about that a little bit longer in length with the omeprazole and esomeprazole podcasts, so if you want to, go check those out for sure. Rifampin is a CYP2C19 inducer, so naturally that's going to run the risk of lowering lansoprazole concentrations. Lower acid in the stomach can lead to absorption-type drug interactions. So what I mean by that is cefuroxime absorption can be impaired. Iron absorption can be impaired when we're using PPIs. There's some HIV meds, itraconazole, mesalamine. So there's lots of drugs that can have their absorption altered because of that change in pH, because of that elevated pH that a PPI is going to induce. There are also drugs that have more absorption in what would be called a basic environment, or an environment where we've got a higher pH. So a PPI like lansoprazole can increase concentrations of amphetamine derivatives is an example here. So some of the drugs used as stimulants for ADHD and things like that. All right, I think that's going to wrap up the podcast for today. Thank you so much for listening. As always, go support the sponsor, meded101.com/store. Leave us a rating, review on iTunes, wherever you're listening. I greatly appreciate that. That helps us grow this podcast. Also share us, emails, class listservs, students, preceptors. Please definitely feel free to share the podcast and help people stay up to date and current on their medication education. With that, I'm going to sign off for today. If you want to track me down, mededucation101@gmail.com, or you can track me down on LinkedIn as well. Eric Christensen, PharmD, BCPS, BCGP. Thank you so much for listening, and I hope you have a great rest of your day.
Hello, it is Ryan, and I was on a flight the other day playing one of my favorite social spin slot games on ChumbaCasino.com. I looked over at the person sitting next to me, and you know what they were doing? They were also playing Chumba Casino. Coincidence? I think not. Everybody's loving having fun with it. Chumba Casino is home to hundreds of casino-style games that you can play for free anytime, anywhere, even at 30,000 feet. So sign up now at ChumbaCasino.com to claim your free welcome bonus. That's ChumbaCasino.com and live the Chumba life.
No purchase necessary. VGW. Void where prohibited by law. See terms and conditions. 18+.